The App Foundation is now nearly 50 years old. When it started, it was set up as a research institute by Dr. Kleber, who was a researcher in the Department of Psychiatry at Yale. So over the years, a lot of research has actually been conducted at this foundation. And there have been many prestigious people who've conducted research here. What I've tried to do over the years with my role as director of research is not just recruit people from Yale and UConn and other universities to situate their experiments here or their clinical trials, but I've also tried to get the word out about what is it that APT is doing. Because APT is this unique philosophy about treating patients, and it's got this really interesting model where at most methadone clinics, for example, people often wait a month to get into treatment, but many people don't withstand that wait time, and some people die from overdose. So what APT has done is to really reduce the barriers to people getting into treatment. So now people who are eligible are getting into treatment the same day, irrespective of their ability to pay. We've written that up, published it. People in other parts of the country are kind of getting more interested in the midst of this epidemic, how do we scale up treatment capacity so that it's not just having really small clinics who are really far away from patients, but having more and more clinics that are available to patients and that can build up their treatment capacity. If there was one additional thing I could change would be maybe the stigma that goes along with treatment, because I think it can be a real barrier for people getting into treatment. Around the country, as I said, for many people it takes a month or so to get into treatment. Not surprisingly, the people who withstand that wait time tend to be those people who are less sick, who are better well off, and who are non-minority individuals. So one of the achievements, I think, of the App Foundation is that it's managed to redress that situation so that people who are poor, people who don't have money, minority groups, as long as they're eligible for treatment, are getting it at the same rate as anybody else. I think there's a real stigma for having the disorder, so having opioid addiction or opioid use disorder, but there's also a stigma for people getting into treatment. Right? So that I think as a society that we give patients this weird message that, okay, you have this disorder, but once then people avail of the treatment, the evidence-based treatment for disorder, they're still stigmatized. APT has transformed from this pretty small, treatment center that focused primarily on maybe treatment studies to one that's more of a community-based organization, where people who have opioid use disorder, that's the focus on getting them into treatment. But we've still managed to hold on to doing a lot of really innovative research at APT. So we've got all these pretty brilliant, investigators or researchers from eminent local institutions here in Connecticut who are doing groundbreaking work on looking at different medications, looking at different types of behavioral treatments, looking at the role of genetics, even looking at things like HIV, Hep C, because these are also conditions that people who've got opioid use disorder are at high risk of contracting. We've managed to offer treatment to a lot of people, do research on the people who are receiving these treatments, and hopefully impart humanizing our patients. And hopefully as well, my impression is that when I go to conferences in different parts of the country, that people look to places like the App Foundation, because not many clinics around the country have scaled up to the same capacity that the App Foundation has. So the App Foundation is now one of the largest providers of evidence-based treatment for opioid use disorder in the state of Connecticut. And I guess I'm really proud to be part of that in some small way.